Depression is an illness. The good news about it is that it's very treatable. It's very responsive to different types of treatment. Roughly speaking, the treatments can be divided into 3 different categories. First of all, the self-help type strategies. Secondly, the talking therapies. And thirdly, antidepressants. And for more information about self-help strategies and for the talking therapies, please refer to the Aware Defeat Depression website. Antidepressants aren't always used, or indeed aren't always required in the treatment for depression, but they are very useful, and I think it's important to understand a little bit more about how they work and why we sometimes use them. Antidepressants aren't simply make me happy types of tablets. I mean, if you take an antidepressant today, you're probably not going to notice any difference until you've been on medication for a couple of weeks. And that's because antidepressants work through our biological sort of nervous system. So really the way that they work is by restoring the balance of the nerve chemicals. Some antidepressants, the more common ones that people are usually prescribed initially, work on serotonin, which many of us have heard is one of the nerve chemicals. Antidepressants are prescribed by your GP generally. Sometimes a psychiatrist will be asked for an opinion, but most people with depression are treated by their general practitioner. Where there are side effects, they tend to be very mild and they tend to only last for the first week or two. The most common side effect with antidepressants is nausea. And probably about 3 out of 10 people will experience some form of nausea. And the way of reducing that is by taking the medication with food. It's important to take your antidepressant on a regular basis. Your GP or pharmacist will give you advice about this. Some antidepressants, for example, are better taken in the morning, whereas other antidepressants are better taken in the evening. And I know it is difficult to remember to take tablets, but what is important is trying to get yourself into a routine so that the antidepressant fits into your lifestyle and that you're not always having to think, did I take my antidepressant? So for example, some people find that if they're cleaning their teeth in the morning, they leave their antidepressants beside the toothpaste. So that reminds them to take the antidepressant. With antidepressants, always talk to your GP about how long you need to take them. Because a course of antidepressants is much longer than, for example, a course of antibiotics. Increasingly, we have recognised that people need to stay on an antidepressant for at least 6 to 9 months after a first episode of depression, and sometimes longer if someone has had more episodes of depression. So talk to your GP about that. Antidepressants aren't addictive, and I think that's one of the worries that many people have, that am I going to get hooked to this medication? Am I going to be able to stop it if I need to? And antidepressants are not like the Valiums or the tranquilizers. It isn't a case of you need to take more of the medication to have the same effect. However, stopping antidepressants abruptly is not a good idea, because sometimes people will experience what's called a discontinuation syndrome. And that's uncomfortable physical feelings, almost like having flu. So if, for whatever reason, you have perhaps gone on holidays and gone away without antidepressants and start to feel unwell, go and see a GP or pharmacist so that you can get started back on your antidepressants as soon as possible. Not everyone who suffers from depression, the illness, is going to require treatment with antidepressants. And indeed, it has to be very much a joint decision between the person and the doctor as to whether they're going to take antidepressants. And I am very strongly of the opinion that antidepressants by themselves are never going to be the complete answer for depression. Antidepressants need to be used with self-help strategies, and can be used in conjunction with some of the talking therapies like cognitive behaviour therapy or counselling. If you have been taking your antidepressants for a few weeks and you feel that they're not working, you don't feel that anything has changed within your mood, go back and see your GP. Sometimes people themselves haven't actually noticed an improvement. It may be other people around you that have noticed subtle changes, when generally speaking, depression just doesn't come on overnight. So the recovery period of depression isn't again just an overnight transition from being depressed to being well. So talk to your GP about this. But if after your discussions with your GP, he or she feels that the antidepressant hasn't been effective, then they may well recommend a change in antidepressants.